The National Health Service has been turned into a system in which poorly defined roles, inadequate supervision, and chronic understaffing are leading to catastrophic errors. That's the conclusion to be had from a Guardian report about a disastrous chain failure that traumatized the 5-year-old girl and led to suggestions of sexual assault against her mother. According to the Guardian, a 5-year-old was left traumatized, bleeding, and in severe pain after a physician associate wrongly prescribed her a vaginal pessary, according to a damning report by the Health Ombudsman. The physician associate suspected thrush and recommended a vaginal pessary and cream. The 5-year-old's mother, who believed her daughter was being seen by a GP, questioned the treatment and the size of the pessary, but was reassured that it was appropriate. Physician associates do not have prescribing rights, and their work must be supervised by a doctor who approves the prescription. But the Parliamentary and Health Service Ombudsman found there was no discussion between the physician associate and GP before the GP authorised the prescription, even though vaginal pessaries are not suitable for prepubescent children, and the girl's symptoms were consistent with vulvovaginitis, not thrush. There was also no questioning of the prescription by the pharmacy that dispensed it. The mother said that after inserting the pessary, her daughter began to bleed and scream in pain, while the cream burned the girl's skin. She took her to see an out-of-hours doctor. However, the girl was so distressed and in pain that she asked the doctor not to examine her internally, causing the GP to raise concerns about possible sexual abuse and to contact safeguarding services. Although it was established that the girl's symptoms were caused by the pessary and cream, not sexual abuse, the mother said the experience was distressing, embarrassing, and further added to her trauma. She said, "I had huge guilt for doing what the physician associate, who I thought was a GP, told me, and feeling as if I had inflicted this trauma on my daughter. But I trusted what they told me. How are we meant to trust healthcare professionals now?" How indeed. Mistakes happen throughout all healthcare systems, of course. But the issue here is that safeguards designed to prevent this kind of error failed at every stage. Here we have a practitioner without prescribing authority recommending an inappropriate treatment. A supervising GP apparently rubber stamping it without discussion. A pharmacy failing to challenge it. A parent believing the physician associate was a doctor. A child suffering severe pain and trauma. And a safeguarding referral for suspected sexual abuse triggered by the consequences of the original error. It seems this has been made possible because the NHS has been restructured to give more responsibility to less qualified people, due to a lack of fully trained doctors. Simultaneously, the government is promoting a model of expanded healthcare through CDCs, as community diagnostic centres, and other out-of-hospital services. And this is the consequence. Defenders of physician associates will say doctors make mistakes too, and this is true. But what makes this case explosive is the evidence that the patient's mother was not clearly informed she was not seeing a GP, the physician associate was operating beyond their scope, and the oversight mechanisms that were supposed to compensate for limited training did not work. The government itself seems to have recognised the political danger. The recommendations of the Leng Review, naming non-doctors physician assistants, restricting diagnostic autonomy, requiring hospital experience first, amount to an implicit admission that the current model caused serious concern. The fact that these reforms were deemed necessary weakens any claim that criticism is merely scaremongering. This case did happen 3 years ago, before the Leng review took place, but the fact that it happened at all, in spite of already existing guidance that should have prevented it, means we cannot be reassured that the review's recommendations will be enforced. And we need to consider the broader structural issue. The intention behind the introduction of physician associates is to increase throughput of and convenience for patients. Throughput is easier to increase when work is shifted downward through the staffing hierarchy. But here's the problem. Doesn't this make the NHS a two-tier system, with doctors concentrated in acute and specialist settings and community-facing services reliant on lesser trained staff under only nominal supervision? That would fit a wider pattern that we can see across public services in the UK, where authorities are replacing highly trained professionals with cheaper paraprofessional roles while insisting standards are unchanged. This case suggests very strongly that standards have, in fact, plummeted. If the public decide to connect physician associates with hidden substitution of doctors, then they are likely to lose any confidence in NHS primary care. Public healthcare depends heavily on trust. Once patients begin wondering whether the person they're seeing is a properly qualified doctor or they are being fobbed off with a less qualified substitute, then that trust is gone. The government wants us to focus on faster diagnoses, more convenient appointments, and reduced waiting times. But what use are they if the care we receive does more harm than good?